Welcome to our webinar. Did you know about Arizona abortion laws? This is a public-facing information session that we planned in collaboration with Desert Star Institute for Family Planning and our Arizona Proactive Reproductive Justice Alliance. And the Reproductive Justice Alliance has been working together for the past couple of years, visioning what access to abortion and reproductive freedom and justice looks like for Arizonans. We started visioning once we, in 2022, elected a Democratic governor and a Democratic attorney general. We felt that she was going to veto things like she did, and we could take a break from playing so much defense and really start to think about what offense looks like. And so what we want to do tonight is to help inform you about the current state of abortion laws in Arizona. We want you to understand the negative impacts of these laws on individuals seeking abortion care. And we're going to help you learn how you can advocate for changes to these laws. And so I want to take a little bit more time, let you know who Desert Star Institute for Family Planning, who we are. Our mission is to create equitable access to reproductive and sexual health care while centering Black and Indigenous people of color. And we envision a world where people exercise bodily autonomy, decide whether or not to bear children, and raise families in safe and sustainable communities free from oppression and violence. These are the tenets of reproductive justice. And so we come from a place where we are operationalizing our values in everything we do. And so we want to provide care that embodies whole person autonomy and full access to care. We want to center Black, Indigenous, and other people of color in compassionate care and policy leadership for reproductive justice and systems change. We want to cultivate an expansive vision for healthcare, advocacy, and community health. And we want to nurture a community of committed individuals who believe in and advocate for our vision and approach to reproductive justice. And you can learn more about us at our website at desertstarfp.org. And then for our Arizona Proactive Reproductive Justice Alliance, our website is nobandsaz.com. So definitely go there to learn more about what organizations are in the Alliance and the work that we want Arizonans to know about. But we are working to advance a future for Arizona where everyone has access to care and resources they need to thrive. And so Representative Sarah Liguori from Legislative District 5 is joining us. Previously, it was 28, and now it's 5. Am I correct? Yes. And so Rep. Liguori is a native Arizonan from Tucson. Her career has spanned in multiple sectors in both real estate and finance, but it was in local politics that she found a way to combine her career and experience and passion to make a difference. Appointed to the Arizona legislature in October of 2021, Sarah previously served in the House of Representatives in 2022 and 2024. She lives and works in the heart of both the districts she currently represents, LD 28 and now LD 5. Sarah strives to find solutions that bring equity and progress to the people. Leading with empathy and kindness, she brings a courageous sense of leadership to fight for what's right. And we love Rep. Liguori. Desert Star Institute for Family Planning Clinic is in Representative Liguori's district. So we spend a lot of time talking to her about what our troubles are. And then a little bit about me. I am a gynecologist by training. I am a complex family planning specialist, meaning I did a fellowship in family planning. I am a gender-affirming care provider. And so I just want to advance reproductive healthcare access through my service, through education and training, through advocacy. I can't help but lead. The buck stops here with a lot of things. I probably need to stop doing that. So as founder and CEO of Desert Star Institute for Family Planning, I really am embracing the reproductive justice framework in my own personal way that I deliver healthcare. And I want the future generation of providers to understand this framework and how to use it and advocate for marginalized communities. Because when we make sure marginalized communities and vulnerable populations are cared for, by default, everybody's lives are better, right? And so I've been involved in convening local and statewide coalitions for reproductive rights and justice, and I have a particular interest in cultivating grassroots leadership in communities of color. And so with that, let's get to it. And so, this is going to be a conversation between Rep. Liguori and I, but for those of you who need to be kind of centered with a visual, we're going to have these transition visuals for you so that you can really lock in to what we're talking about tonight. And so the first thing, did you know about abortion bans? So we've got 15-week ban. We've got 20-week ban. We've got a genetic abortion ban. And we've got a telehealth abortion ban. It's really important for people to understand that a lot of these laws that we see on the books in other states that are being enforced in other states are actually in the law books for Arizona. But prior to Roe v. Wade being overturned, we had great success litigating these laws to keep access available to Arizonans. And so when Roe v. Wade was overturned, we lost that. And that's how Arizonans have been living under a 15-week gestational ban since January of 2023. And so what is the impact of this?
That was my question to you, Dr. Taylor. What has been the impact of this? And I love the no bans because, truly that there should be no bans on access to this type of healthcare. But what have been the impacts from your perspective in your clinic with the uncertainty that you see and the uncertainty that your patients are facing?
So, it's early on when we were in limbo, like what's legal, what's not, waiting for some type of leadership from our state legislature. It was really difficult to turn patients away. And we originally were turning patients away because we didn't know what was legal. And then once we knew it was legal, we were turning patients away because of gestational limits. People who just couldn't understand why we couldn't terminate their pregnancy when the baby wasn't going to be okay. Like, why are they being forced to continue a pregnancy like that? There's been no access to abortion for the most part in northern Arizona. Telehealth has expanded for all other types of care for rural Arizonans, but they can't do a telehealth visit for this. And with all of the web of restrictions, it's created this situation where people generally just have to come into Phoenix to access abortion. And that then creates additional burdens related to not just the finance and the cost of having an abortion, but all the other coordination that people have to do in their lives to make sure they can get into Phoenix to get the care that they need.
And just for those who may not be familiar with it, the telehealth abortion ban, and you stated the year, it was a while ago, preemptively before a lot of the yo-yos with the weeks. It really harms access to care in rural areas because they do not have the same ability to get abortion, contraception. Because of this ban, they have to physically drive in to see a physician or a doctor or a provider that can sometimes take hours. And so it really puts undue and added strain to those that aren't in, even though we only have a few abortion providers in the state, these rural areas are very strained, and it really limits access for them to get this type of care. Do you see a lot of those patients making their way to you?
Specifically for abortion care, yes. I would suspect that people are using some of these other ways to get birth control, like the pill club and those type of things. I've had patients tell me that that's how they've been able to get their birth control otherwise. But yeah, when it comes to needing abortion care, then they definitely have to figure out how to get down into Phoenix.
Yeah. So it's an undue burden, and it's disproportionately on rural and non-urban pregnant people that live in this state. It's an unfair and cruel law amongst many of the other ones. And then with
And
the
also
bans.
thinking about our indigenous population where, you know, access to even getting off the reservation to get down. I had a patient shortly after Roe was overturned who had an appointment, and the person who was her ride from the Navajo Nation didn't show up. And so therefore, you know, additional time passed before she can make her way down here. So we really take for granted people's ability to move across the state.
And that's at least a 4-hour drive, if I'm not, wrong on that drive time. So that's 4 hours to travel to see a provider to get, access to this type of healthcare. It's really such an undue burden. And
And then we also have the bans that then create criminal penalties for providers. So not only, you know, are patients having to navigate these things, it's there's a chilling effect, obviously, in terms of we want to serve patients, we want to do the best we can for people, but we also want to stay free. Right. And so I say often I didn't go to medical school to go to jail. And I stand by that comment. And so, you know, again, there's a lot of good talk out there about civil disobedience. But at the end of the day, I am proud to be an abortion provider, but I'm also people's other care provider. And they would like for me to stay free as well as myself and my family.
of course, but I think that's the intention, right? Is to put that fear into it. We've seen in other states and here that, they're targeting not just, you and providers, but also anyone that is pregnant and anyone that might be, aiding or abetting someone in getting an abortion. And the fear behind that and the criminal penalty behind that, I'll use the word atrocious, is atrocious to see that that's how we're treating pregnant people. And like, you went to medical school and now you're under the threat of potentially going to jail for practicing medicine in the way that you want to. Very cruel.
And sometimes I feel like the cruelty is the point, like, you know, with what we're seeing happening just, you know, in the last few days here. And so we really want those of you who really care about this issue and are advocates to really make your voices heard on this matter.
And right now, can you tell us, one of the resounding themes since I've been at the legislature, like you outlined in 2022 and 2024, was, being there with the fall of Roe, watching women and children and people that were at the Capitol getting, pepper sprayed by police, in protest to it, innocent people just there. And then last year with the territorial ban. So, fighting against the 15-week ban in 2022 that, we knew, and then it was, publicly exposed that it was intentional to ultimately reverse it back to the 1864 abortion ban. And then, in a bright spot in all of this work was overturning that and the governor signing that along with Prop 139 this year. But from where you sit today, is there any more certainty as some of these fights are now legal? We have the Prop 139 enshrining in the abortion access in the Constitution. How do you feel in this within the scope of all the bans, and how do your patients feel with where we are today?
I mean, make no mistake, we're still living under a ban. And so that's the thing, like there is a lawsuit happening. Healthcare providers started a lawsuit to sue about now that the 15-week ban is unconstitutional because of the constitutional amendment. And so those of us who have started to provide abortion beyond 15 weeks are trusting that, you know, the Attorney General says that while this lawsuit is going on, that the law cannot be enforced, and therefore the criminal penalties attached with it cannot be enforced. And I'll say, and I've been in Arizona since 2009, and so we've done similar things where, you know, litigation is happening, and so we go ahead and provide care, and there hasn't been any, you know, negative repercussions for that. The thing is, this information doesn't get to the public quickly. And so generally when there's a lot of press about abortion, the first thing that people think is they can't get them. And
Mhm.
so we have a lot of work to do to really help folks who need abortion care know that they can actually get it. And so now, early on, we were like, hey, we're going to do later procedures now. Uh, the phones didn't ring the first couple of weeks because it didn't really settle in. So now people are starting to understand, what their access to care is. And we are seeing patients coming in later in pregnancy. And, these people have always been with us. They've always needed care. So the question was, did they have the resources to leave our state? Or did they stay pregnant and now either start or add to their family when they weren't ready to do so?
Interesting and accurate. I think the whiplash is being felt, and then it's not always. It takes a while to communicate it out to the public, especially when people have been living in fear and uncertainty for so long, just from a patient perspective. Um, as someone who has, been pregnant twice, I speak from, my personal experience of each time you go to the doctor, um, it's nerve-wracking in its own sense, right? Because you hope that everything's okay. If you want this pregnancy and you hope everything is healthy and your scans are good and you get good feedback. And there's just that you're focused on, that mom and baby are healthy, and then you layer in this uncertainty with what are the criminal or legal repercussions, what are the politicians, what limitations did they put on us today. It's just an added level of anxiety from a patient perspective of one, I didn't have to experience being pregnant before Roe fell, but I can't even imagine what patients are going through as they're trying to wrap their minds around what they might be walking into outside of the normal health and wellness that they're hoping to have, or the certainty that they're trying to have in seeking abortion care. And then on top of that, could you maybe discuss a little bit about the impact on insurance coverage for abortion care and what that landscape looks like and how burdensome that is for individuals, especially lower income or marginalized?
So Arizona is a state that does not allow public funds to be used for abortion care. And so in our healthcare exchange and federal employees contracts with insurance, they allow employers to carve out abortion and even contraceptive benefits out of their plans. And so a select few people have really good insurance plans where their abortion is actually covered, and we're often like shocked when someone says my insurance actually covers it, and then it turns out that they actually can use their insurance for an abortion. But yeah, we've had
How
some
often how often does that happen? I'm curious. How often do you run
not
into?
very
Okay, like
not very often, and it's generally someone's private insurance, and it is I like to think of it as like Cadillac insurance, right? Because the
mm,
average insurance plan says they'll cover a quote unquote medically necessary abortion. But that usually means that you have a medical problem that, requires you to preserve your health to have an abortion. And that's not the case for most people seeking abortion care. I mean, definitely, pregnancy can cause some lasting imprint to somebody's physical and emotional well-being. But at the end of the day, that doesn't count for insurance companies.
unfortunately. And so the financial burden on top of the, physical burden of having to drive, somewhere or not having, resources nearby. And then also the financial burden of having, no access and having to pay out of pocket hundreds of dollars, if not thousands of dollars. Um, Again, another one of these ways that I feel like um, politicians are trying to meddle in and restrict abortion care, and it's another area I think we need to continue to look at and try to see if we can get that coverage reinstated.
Public funding is really important. Arizona was one of the slower states to recovery during the recession. Jan Brewer expanded Medicaid on the way out. And now a lot of people are being disenrolled for the last couple of years. So a lot of our patients are either on Medicaid or Medicaid eligible. And so they can't use that. And you have to be pretty poor in Arizona, honestly. I'm from California, so the income requirements are a bit different. But you have to be extremely socioeconomically disadvantaged to get onto access. So you can imagine then that somebody has to come up with the funds to pay for an abortion. Our abortion funds literally run out of money mid-month. So it's a difficult landscape financially for patients.
Again, another thing for patients to navigate, another thing for providers to navigate, and another impediment. And I don't know if that might be a good segue to talk about the trap laws that we wanted to discuss now here.
Yes, so I want to center us with another visual before we go into this conversation. And so for this one, did you know about patient restrictions and provider limitations? And so when we're talking about these, we are talking about our targeted restrictions against abortion providers. That is what TRAP laws is short for. And then we have our physician only requirement here in Arizona. We have waiting periods. We have care refusals, which are legal. And so let's get into it.
Okay. Well, I love your visual. And those are some great examples. And I'd love to even like kind of role play of walking through as a patient and, going through each of those to show how they are, impediments and roadblocks and speed blocks set up. But for the sake of this conversation, also wanted to say on what trap laws are, if we think of it as like abortion policy in a wolf in sheep's clothing. So it's not we're trying to ban abortion, it's just we're trying to do death by 100 cuts to abortion care providers and put restrictions on reproductive health care. So the intent is not, especially pre-Roe, it was really to circumvent and undermine abortion care. So regulations are up, which means more hoops for patients, more hoops for providers, and therefore they could hope that enough providers would leave or enough patients would not be able to navigate it. And therefore that was kind of the false sense that they would put out there when these laws were being legislated on. Some of them, you might even read the title to some of them and say, that doesn't seem that bad. But when you get into the details, you really see the intent of what they're trying to do is make it very difficult for patients and to handcuff providers. So it was seemingly harmless sometimes, but same intent as trying to ban abortion. And they've significantly impacted abortion access in Arizona. As you know, you mentioned a lot of them, the 24-hour waiting period. So if we could, I know we're kind of making this up on the fly, but if I'm a patient coming to see you seeking an abortion, what would you tell me?
So we are required by Arizona state law to provide you this scripted information. It doesn't really discuss abortion very much, but we are required by law to provide you this information. Everything that's described to you here about the characteristics of pregnancy based on gestational weeks, up to 8 weeks is what you would see under a microscope. And then the rest of it, you could see visibly with your eyes. You will be signing an attestation that you received this state mandated information in advance. We are not allowed by Arizona state law to provide you abortion care the same day as this consultation. We're going to go over all of your options, what to expect, answer all your questions, and then we'll get you scheduled before you go. We have to wait a minimum of 24 hours from this consultation before you can complete your abortion care.
So I have to come back. I can't get the care I need today.
We cannot do your abortion today. We comply with the laws of our state.
I'm not sure I can come back tomorrow. It took me so long to get here today. I'll have to figure out if I can get a ride back here or miss work and come back here tomorrow then.
And that is absolutely the case, and we'll do the best that we can to make sure that we can accommodate you. But we do follow the law, and that is the law of Arizona.
So I would say, are we end scene to say that
That
it's
is exactly what happens. That is exactly what happens. The patients are like, what do you mean? I can't be seen today. I need to be seen today. I need to be seen today. And we're like, we follow the law. I tell the staff, those are the words now. Like, you don't, we follow the law. We follow
yeah,
the law. That just becomes like, you see Jade in the chat, 100.
yeah,
Because at that point, you can't go down that rabbit hole of compassion. Because the other thing too is we have fake patients who video things and they take things out of context. Oh, that's a 1,000, Jay put 1,000, not 100. So we also have to be vigilant about that too. Like you show compassion and then your words get twisted to telling somebody something that was illegal and now it's all over the place and we're providing legal abortions. So it's a complete mess.
uh, yeah. And again, from a patient perspective too, the emotional and even psychological and all the planning that goes into it is another layer that's unnecessary when you're seeking abortion care. Could I ask you from like the provider perspective, some of the things that you named? So, like any of the requirements for the facility or admitting privileges or reporting obligations, like what is it for you on the back end? What are some of these other trap laws that have been put in place that, inhibit your ability to provide care?
A very important one is the fact that an abortion clinic designation exists at all. That opens us up to be treated differently than other healthcare providers. It opens us up to the state showing up at any time and occupying our clinic for 2 days. As with other regulatory bodies in healthcare systems, they get inspections, they very well do. But someone calls ahead and says, hey, it's time for your annual survey. When should we schedule to come in? And so because we don't get that courtesy as abortion clinics, they just show up. So it's stressful for staff to stay inspection ready at all times. And as someone who runs a clinic, I can't give people leeway for making errors because those errors could cause the clinic to be cited and closed and patients lose another provider to that. And so it can be a very stressful environment for staff. We try our best, to have a staff that we really look after and care about each other and enjoy working together. So that helps, ease some of that burden, but it is a significant burden to be inspection ready at all times.
Again, I'm hearing, fear. It instills fear and another layer of just over scrutiny that not any other healthcare provider has. You're singled out as a provider of abortion care for this.
Yeah.
And
And
all
then
the
the admitting privileges really is one of the main reasons that the abortion clinics are concentrated in Phoenix. Because I personally, when I worked for uh, another provider previously, when I came to Arizona, I attempted to get admitting privileges in Northern Arizona. And here's the thing about admitting privileges. You admit people to the hospital, and that's how you get them, and that's how you keep them. Abortion is so safe, no one hardly ever gets sent to the hospital. And so therefore, to get and maintain hospital privileges, you actually have to spend time in the hospital. So, it's a guise that, oh, patients are safer because I have these admitting privileges. But really what it's done is it's weeded down the opportunity for people who are able to provide abortion care and where abortion care can happen because of we have to be in a 30-mile radius of the hospital we have admitting privileges for or in agreement with someone who has admitting privileges to be able to provide the care.
50 miles.
30.
Yep. 30 miles. Okay, thank you. Yep. So another, wolf in sheep's clothing, we would say, on the admitting privilege aside. And then the reporting obligations, can you speak a little bit on that one? How burdensome is that to you and how necessary is that to the care that you provide?
So we have a forum that we collect data from patients about their demographics. I mean, like, are they married? What their educational level is, how much money they make, um, how many children, how many pregnancies they've had, what's happened with each of the pregnancy, and a few other things. The reason we're supposed to collect the reason why someone's having an abortion, and then it's anonymous report to the state, but still we have to attach a report number to the patient's chart. So obviously, when the state shows up, they see that this has actually happened, and then they can actually like match it to a report that was actually created. And so then we also have reporting about all the different providers who come and how many consultations they do, how many abortions they do, and I have to sign an affidavit that I'm not performing an abortion for the race or sex or genetic abnormality of the fetus. And that gets uploaded to the abortion report to the state. Also certifying that we did not see a fetus born alive during an abortion, including a medication abortion where that's happening at someone's house and we're not actually seeing what happened. So those are the major things. And so it's really about, you know, it creates more administrative work, which then adds on more staff time. And so with Desert Star, I like to say we limped out of COVID into the Dobbs decision. And so the clinic was on shaky ground for sustainability for a long time. And so in order to be able to keep the clinic going with these reporting requirements, that's why the clinic is only open to, and now consistently now this year, 3 days a week, because the staff needs that additional administrative time to do all of the other things. Now, as a clinic, we do the normal things that clinics do. We make sure that, we have the inventory we need to take care of the patients. We make sure that our instruments are sterilized, right? We make sure that, we do all of those things medically necessary to take good care and safe care. We run controls on the tests that we do. So all of those things are basic health care, but these reporting requirements are not. And so with the small, nimble staff that we have, operating less days a week, so that that same staff then on a non-clinical day can do all of those other things. That's how we keep the clinic running.
And I would say, yeah, a small but mighty, 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 staff that you have alongside your work too. We've touched on maybe four, no, probably six of the trap laws. And I think that's, also something to reiterate for this webinar is it's a did you know? So we've talked about maybe six, but there's 50, that are in place here. And the stat I'll give the group is that between 2011 and 2017, all of these laws combined ended up with 80% of Arizona counties without a single clinic offering abortion services. So it was just, so cumbersome that we've lost 80% of abortion services in the state, leaving major healthcare deserts like we've just talked about, and access to rural and tribal communities obsolete. And so I go back to that, like, death by 50 cuts, we'll say, because each one of them, is a sliver. But when you add it all together, we've lost the majority of great providers like yourself because of these trap laws. And that's where our sights are set now in the work to make sure that we can remove these barriers and to increase opportunity for pregnant people to just get the access to the care that they need without all these burdens alongside of it. So it's a testament to you and your staff to still be providing just the highest level care that you do and the way that you do. And I just want to say, like, your patients are lucky to have you because it really, I know it's not been an easy road between COVID, Roe, the 1864, and all these 50 laws that have gone into place. You're still standing and you're still providing the care that we need. And so I just want to say thank you, I guess, at this point.
And I do want to mention too, the physician only situation.
Okay.
When I first came to Arizona in 2009, There was a nurse practitioner providing surgical abortion in Tucson. And I personally trained a nurse practitioner to provide first trimester surgical abortion in Phoenix. And then we had advanced practice clinicians, which are your midwives and physician assistants and nurse practitioners who were doing the bulk of medication abortion in our state. So that's how we were able to, even though the physician privileges law was in place, we could still get people medication abortion throughout the state because we had our advanced practice clinicians at least being able to do that. And so the first law that passed was that nurse practitioners could not do surgical abortion. And then the next law that passed was that the medication abortion would be regulated like surgical abortion. And so then that's what really wiped out the access to care outside of Phoenix, because our nurse practitioners and PAs and midwives were doing medication abortion throughout the state.
So
I
it makes medical sense, but then it gets tied up in political ideology that is not tied to medical sense.
And we also have short memories. Well, I don't know that the public really knew that nurse practitioners were doing surgical abortion, but I think it made sense to community that they would at least be help doing medication abortion. But I will say that it's really all about training. Like, because we've been exposed to this narrative for so long, we've been conditioned to think that only physicians should do this.
Mhm.
And that's not the case.
Mhm.
And for me to have to go into a room just to hand someone a mifepristone pill, when my skills are needed elsewhere, that's definitely a big reason why people don't have access in northern and southern, in more access in southern Arizona.
And I think that point you make is really, really huge because of the short memory, and then we get used to it, and then we think this is how it always is.
Mhm.
Not true, not the case. This is, again, these layers of laws from, 10 plus years ago. And it reminds me of a physician that I met over the summer. She was here um, working with a provider going through her OBGYN residency. And
Mhm.
she was here because she was visiting from Poland and they had outlawed abortion. So she had to come to America in order to complete like this section of her training. And so it really was a moment, of like, is this what, this was before Prop 139. This was in the middle of all the arguments last year and all the fighting on it is this where we're headed as a country? And to your point, where we get used to just saying that, like, sorry, we can't train on this. We don't teach this in medical school. Like, this is not even a learning opportunity for medical students in the United States, where our we're going to have to ship out to different countries because our state or our country has, or even outside of the state, just to train on this. Will medical students not be able to learn abortion care because the state has been so restrictive, or the country has been so restrictive on it? So I think it's just a good point to look back on of did you know, and also a warning of for the future, and why we have to work so hard to not just recover the ground that we've made, but keep fighting to recover more, to say, no, this is not normal. This should be accessible and open for everyone. Um, because it is status quo now doesn't mean that's how it needs to or should remain.
Absolutely. I see a question in the chat. It says abortion not allowed for genetic abnormality. Can you speak to this? Thank you. So there was a law, actually, there was a law that I want to say, like, threw everything in the kitchen sink in it. There was fetal personhood in there. We weren't able to provide abortions for fetal genetic abnormalities. There was, I'm trying to recall, is this the same one that had the 15-week ban in it or not? Um, I think that one was a year before. So that one was a year before the 15-week ban. So there was a bill that had fetal personhood in it, which I was like, okay, this is a low key total abortion ban, because how can we do an abortion if a fetus is a person? And then in that we couldn't provide abortions for genetic abnormalities and a few other things in there. And so what happened was we sued. This was before Dobbs' decision. So yeah, the 15-week took effect after that. And so the judge was like, no, you can't enforce not doing abortions for genetic abnormalities. But the judge did not rule on the fetal personhood part. So that was kind of out in the open. That was in the air. And so what happened was when Dobbs' decision overturned Roe v. Wade, that same week, the Supreme Court told Arizona that they could enforce their genetic abortion ban. That flew under the radar.
Mm-hmm.
And so that's been going on now since even before the judge ruled harmonizing the 1864 total ban with the 15-week ban before it was ultimately repealed. So even before the 15-week ban took effect in January 2023, we already could not be doing genetic abortions because the Supreme Court allowed Arizona to enforce that.
And so that specific piece is tied up in the legal aspect right now on this continued push. Mm-hmm.
Yeah.
I don't have anything to add to that. It's it hopefully is resolved. I don't know what the timeline is.
Yeah, I think because it's been back and forth, I know like I think sometimes, so what happens is not all litigation goes the same. So sometimes you'll get relief from the judge and say, oh, you can do this while the lawsuit's going. And then other places like, no, you can't do this while the lawsuit's going. And so in the case of abortions for genetic abnormalities, we cannot do that while the lawsuit is going. And I'm no legal scholar, so I'm not quite sure why, but I would suspect it's because the Supreme Court said that it could be enforced, and that's probably why it's still being enforced.
And then that would be you as the provider, criminally charged for that, if so. Is that correct?
Yeah, so this was before they started putting prison time to them, but there's financial and civil penalty potentially.
Okay. Yeah, thank you for that. And that's a great question. Any other questions that we want to cover or?
Yeah, so there is the last piece of this is patient privacy in education. And so what we're looking at here is collecting reasons for people's abortions. And so we talked a little bit about that. And then limits on sex education. And so with these two, it's really important to understand that sex education and people's ability to practice bodily autonomy are very much intertwined. And so if young people aren't learning about their bodies, how pregnancy actually occurs, being taught about contraception, then they aren't able to fully, protect themselves and to do abstinence only and then become a parent if you happen to become pregnant without having any conversation in between about how pregnancy happens, that we're definitely putting our children at a disservice. And so another piece of what's happening now in Arizona is anti-abortion sentiment is baked into every area that is being legislated. And so, for example, Planned Parenthood would go into schools and do sex ed. Well, because Planned Parenthood is an abortion provider, then Planned Parenthood can't get the grant funds to then do sex ed at the school districts that they were previously doing this education for. And quite honestly, abortion providers are like the jack of all trades as it relates to the complete and comprehensive family planning. Like we provide all methods of reversible birth control. Like we make sure people get tested for STDs when they're when they're sexually active. So we generally do more for our communities than abortion. But when you start to have these regulations about how funds can flow to these entities, then you also take away a major resource as it relates to sex education for our young people. And so that's kind of a low key way of really advancing not only the abstinence only education, but also limiting the resources available outside of these settings, because organizations can't even get funding to provide the education outside of the school setting.
Yep, very effective. If you can control the money, you can blockade what you would like. And what about parental consent? I know that there's, different mandates around, parents have to sign off if they want their child to participate in it. I don't know if you want to talk about anything there or anything else regarding like the actual education that is able to be happening in the class. I know I would put that under another, burden and barrier from just having education be education in schools regarding sex education. It's now, layers of parental rights and curriculum approval and what the state will mandate and what the school board needs to review and restrictions on content and, different requirements where it's almost like, death by 100 cuts. Is that kind of the assessment of what you think sex education is in Arizona right now?
So the interesting thing about so Arizona has a parental bill of rights. And we come up against this all the time where thankfully we can continue to push back that in relation to other types of reproductive health care, a minor can access, for example, sexually transmitted infection testing. A minor can, which is someone who is under 18, can, consent to their own birth control. And so in that regard, we are able to protect young people in that way. But as it relates to their ability to have an abortion, there is a notarized parental consent. There is a subscribed form by the state that makes the abortion sound very scary. Both the minor and the parent need to initial that, and then they have to go before a notary, a stranger, and present documentation that this is indeed the parent of this minor, and have that consent notarized and brought back to the clinic to be able to have an abortion. And so then we have the process of judicial bypass, which means that a minor can go before a judge to be deemed emancipated so that they can be able to they can be able to have an abortion without their parents' consent. And so this is extremely problematic because most minors have parental support for their abortion. And so what these laws are, where we're trying to protect minors from, are the situations where, hey, someone in their family is the one who actually got them pregnant, maybe even their father or mom's boyfriend. Like these, we are trying to protect those minors who are not safe. And this parental bill of rights puts them in harm's way by trying to get them access to minors' records, access to school records, where we're trying for the LGBTQ youth. That's another place where this is problematic. And so, we're not, trying to, groom and manipulate minors. Again, we seek to bridge the gap between understanding between minors and their parents. But what we also want to do is we want to protect minors who aren't safe.
I was going to say keeping them safe, and that's what physicians are. That's the whole nature of the work that you do, is to keep people safe, and that extends to children. And again, the burdens placed on, even in a perfect scenario, for a parent and a child to have to jump through those hoops, let alone a child who might be scared and in a precarious and unsafe position to have to go through that, is just gut-wrenching to think through, and goes, I think, against what the parental bill of rights is trying to do in protecting children. it's actually putting them directly in harm's way.
You know, I appreciate, you know, that you are a legislator and you want to paint your colleagues in the best light possible.
I'll laugh.
But it's not the point of the Bill of Rights, really, for me. I feel like, especially how we're getting extremists being voted into our school districts as a pipeline to get them to, you know, other offices to continue to, you know, do harm. I think that this parental Bill of Rights is actually meant to do harm. And I would say maybe the people who are behind it don't think they're doing harm, but those of us who know better know that they're doing harm. And so I feel like there are specifically people who are hateful and bigoted, and they want control over, you know, what's happening. And I think some well-meaning parents get swept up into that because, you know, the arguments can be pretty compelling on their face. But I think when you start to have conversations with people, it's like, well, we know that you would show up to make sure your child is okay, but not all parents are like you.
I could not agree with you more. It's totally the context of how it is packaged and sold within the Bill of Rights. You know, for parents of we're trying to protect the children, and then when you actually go through it, I would compare it to the trap laws. It's burdensome, and it's a wolf in sheep's clothing under the guise of protecting children. And time after time again, we see it's either restrictions, constrictions, and then putting them in unsafe positions. They're children. We are the adults, we know better, and we should be doing better for them. I couldn't agree with you more.
And so we can take some additional questions from folks before we go, before we close and provide our call to action. Does anyone have any questions? You can go ahead and place those in the chat and we can answer them. Kristen, do you feel like the response to your question about genetic abnormality was answered well enough for you? On its face, you're like, why would the legislature do that? At the time that during that legislative session when that bill was introduced, they really leaned on the disability community as props. They used people with Down syndrome as the kind of poster child for not doing genetic abnormalities, because a good number of genetic abortions are due to trisomy 21. And, you know, I argued that, are you providing the resources for families to parent children with disabilities? If you're forcing people to bring a child with disability into their family who, you know, could eventually become an adult with ongoing special needs, are you also providing the appropriate school environment for these people? Are you providing the appropriate healthcare resources for these people? Are you providing the financial, the time that's required to take care of a special needs child, because you can't work full time. In a lot of households don't have two parents. So like there are so many things for you to judge to say, well, you know, someone with Downs can live till they're 30 something. And that person is living and being taken care of by their family the entire time, and then they pass away. So it's something for me where, you know, they really use the disability community as a prop, but then what else are you doing for the community besides using it as political props? Elizabeth's trying to recruit people to Blue Sky. And Becky, thank you so much for the discussion. It has been
Thank you, Becky.
quite educational. I appreciate both of you. Thank you so much for joining us. So I am going, yes, very insightful. We still have much work to do. And so I just want to have us close with a final call to action slide for us. And this is gonna, actually, let me not do that.
And I would love to say, if you learned something tonight, as part of the call to action, like, share it. You know, with a friend, share it in a conversation. Hey, did you know that here's one of the restrictive abortion laws, you know, still in Arizona, or here's a way that patients or providers are being hindered from accessing or giving care, abortion care. I think that hopefully one of the things is just to start to talk about this more, to understand that, you know, we are still in a very precarious time, even with the momentous win and the massive turnout from voters across the country, not just in this state at like 62% of voters that voted approved Prop 139. But there are so many little roadblocks we need to peel away, and then we need to keep working, because who knows what this potential new administration might do. For example, we still have the legal suits going on. And then, as we've heard from Dr. Taylor, you know, a day in her life, or a day working with her patients, is not just, okay, there's certainty now, we can perform this. There's a lot of other little things that are preventing and keeping people from getting the care that they deserve or that they need. So, and then also, Judy, soon, not yet, there's a number of abortion repeal bills that we're working on. Dr. Taylor has been a wonderful stakeholder in that. And so we are working with a coalition of a couple legislators there to get those dropped soon. And then we need to get them heard, which, you know, also, if you pay attention to the legislature, is a feat in itself to get a bill heard, if you're in the minority party. So the advocacy there is welcome also.
Yes, and that is a great segue to our call to action. So one thing that you can do is contact your legislator and let them know that you voted for abortion access and you expect them to deliver. It was not on my bingo card for the 1864 law to be repealed. That required opposition to join the side of those who are trying to protect abortion to repeal that. So who knows where people's hearts are and where their minds are. So you have the power as their constituent to say, I voted for abortion and I expect you to deliver. Another thing you can do is support organizations working to protect reproductive rights and advance reproductive justice. So Desert Star is a provider and an educator and an advocate on your behalf. So it's tax-deductible donations to our organization at desertstarfp.org. And please, please, as Representative Liguori said, spread awareness about these issues. There are some news outlet that used to say democracy dies in the dark. So I think that we have some dark times ahead of us, and we can't count on the courts and we can't count on the news, but what we can count on is each other. And so we are what we need to get through challenging times. And as we just celebrated MLK, the moral arc of the universe is long and advanced towards justice. And we will get to justice.
Perfectly said. And thank you all for being on. It's good to see new faces and familiar faces, and all those working alongside, you know, Dr. Taylor and us in this work.